as the U.S. mulls over its future COVID-19 vaccination plan. Data from 3 large healthcare systems indicate that even though a small percentage of people under age 65 have gotten the new COVID-19 booster, people this age are not becoming severely ill and overwhelming hospitals. Even if they're no. We're not seeing it. It's not happening. The U.S. Food and Drug Administration has proposed a framework for annual COVID vaccinations for all Americans over the age of 6 months, but at a meeting with its vaccine advisors last month, it did not come up with a concrete plan. Vaccine advisors to the U.S. Centers for Disease Control and Prevention are scheduled to meet February 24 to discuss the future of the U.S. COVID-19 vaccination program. Uptake of the bivalent booster, which has been available since September, has been low. Nationally, only about 16% of the population has gotten it, and the rates are especially low for people under 65, according to CDC data. Narasimhan and doctors at Montefiore Medical Center in New York City and Clalit Health Services, Israel's largest healthcare organization, say the relative mildness of current COVID strains, along with a degree of immunity from previous vaccinations and infections, are going a long way toward growth. Ran Balicer, director of the Clalit Research Institute and chairman of Israel's COVID-19 National Expert Advisory Panel, noted that at earlier points in the pandemic, for example, when the virulent Delta variant was raging, it was not responsible to opt out of the vaccine. I don't think that's. I think when you're under 65 and healthy, it's a much more complex question, and I think that's where individual risk assessment and personal preferences come into play. Since the new booster became available, about 12% of all COVID deaths in the US have been among people younger than 65, according to CDC data. A report released by the CDC on Thursday analyzed death rates and vaccination status from September through December.